Today we're going to be looking at a neurological chart. Here it's titled Head Injury Observations, but generally we call it a neurological chart, not to be confused with a neurovascular chart. They're two different things. Neurological is for the head, neurovascular is for circulation of the limbs. So with this neurological chart, although this one is from St. John of God, they are all completed the exact same way because they all use what's called the Glasgow Coma score, or Glasgow Coma scale, sorry, which is it's based out of a total of 15, and it always asks the same questions. So to begin with, you always attach a patient label in the top right corner, put in the year here. Now the day and month needs to be squeezed in up here along with the time, as this paper is used over multiple days. You cannot put the date just in here. The first thing we're going to look at is when we assess our patient, we're going to notice if their eyes are open. Are their eyes opening spontaneously? If they do, then you will write in 4 up in this box. Do their eyes only open to speech? Then you will write in a 3. Do their eyes only open to pain? Or none of the above? You would write in a 1 in this square. Moving on, we have the best verbal response. Is the person orientated? What that means is, can the patient tell you their name, where they currently are, and what the current month is and current year? It's important not to ask if the patient can tell you the time, because all they need to do is look at a clock on the wall. That does not tell us if they are orientated or can remember what month or year it is. So you'll note here that at 9:25 on the 3rd of October, the patient was not orientated. In this case, the nurse deemed the patient to be confused, so they wrote a 4 in the box that corresponds. However, the next day at 1300, the nurse assessed the patient, asked for their full name, asked where they were located, and asked what the current month and year was. And the patient was able to answer all 3 questions correctly, and therefore the patient received a score of 5. Moving on, we have the best motor response. Does the patient obey commands? It's as simple as, can you give me your arm so I can take a blood pressure? Localized pain is where they can indicate that they're uncomfortable, but they're not following commands. Withdrawal is where there's pain or uncomfortable, they will just pull their arm away. And flexion and extension are usually indicative that there is something severely neurological going on. Usually it requires ICU intervention. Or none of the above, where there is no motor response if they are in a coma or unconscious. So what we do for the date of the 3rd is we tally up our totals. So here we had 4 plus 4 is 8, plus 6 gives us a total of 14. So the patient was 14 out of a score of 15. So that indicates that there's a little something not quite right neurologically with them. The next day, however, they were 15 out of 15. When tallying the score, most people should be 15 out of 15. If they have a known diagnosis that might impair them neurologically, such as a history of dementia or Alzheimer's, or an acquired brain injury, if they score 14 out of 15 and we expect that that's their score because of their medical history, we don't become concerned. Where we become concerned is if the score drops lower than what would be considered normal for them. So for most of you listening to this, I would expect a score of 15 out of 15. However, if you cannot tell me what your name is, where you are located, or what the current month or year is, that would drop you to a 14 out of 15. At that point, I would become a little bit concerned about your neurological well-being, and I should be notifying the doctor and asking them to come and review. Moving down, these charts are all set up to allow us to record vital signs here. However, we much prefer to use the hospital developed observation charts that you've previously learned how to use to document vitals on. So in this case, we just write C-OBS chart, and that refers people to go check the observation chart for blood pressure, pulse, that sort of stuff. Moving down, we're going to check the pupils. Are they equal and reactive to light? So you've got a pupil scale here, and when you're assessing the size of the pupil, the number that you're going to document in this box is the size of the pupil before you shine a flashlight in it, or a bright light, okay? So for example, most people will sit at about a 4, and as soon as you shine a torch into their eyes, their pupils will go down to a 2. You will document that their pupils were a size 4. Then you will shine the torch in their eyes, and if their pupils shrink, meaning they react, you put a positive. If there is no reaction, as you can see in the legend over here, you put a negative. If their eyes are closed, for example, they've been in a trauma or been beaten up and their eyes are swollen shut, you would be unable to assess pupil reaction, and therefore you would write C for eyes closed. Moving on, we're going to assess limb movement and strength. So we start with the arms. Do the arms have normal power, mild weakness, severe weakness, spastic flexion, which is where the patient's not controlling the flexion, or extension, which is where the muscles are pushing away from the body, or no response to the muscles at all. You'll note that I wrote L/R. This is because the left arm can differ from the right arm, so it's important to document both, as it says over here. Down here, I put L under normal power and R under mild weakness. So you can tell that the patient had normal power and strength to their left leg, but mild weakness to their right leg. However, the following day when they were assessed, both were deemed to be normal power, so we can tell that the patient's condition is improving. So with all of this documentation, that is the neurological chart, it is important to complete the full page when reviewing your patient.